So that's it. Remember, don't remove foreign objects from the body that you found in the body that remain there. For example, foreign object, now think about typical example, maybe la parabrezza, maybe the show glass, the glasses that enter into the person. I don't remove them because la loro estrazione potrebbero peggiorare l'entità dell'emorragia. Hemorrhage, some people can suffer from internal hemorrhage. Is it clear? All these things can increase the entity of it. Prestare molta attenzione a non farli affondare nella ferita durante la fasciatura. Now, watch. Remember, we learned that they said one of the things you need to do if a person is bleeding is what? Cover it. You go use fasciatura, cover them. They can say, don't overcover the thing. Is it clear? Because they said non affondare. Fai attenzione. So you will not over tight it. Is it clear? When you are tightening it, when you are covering the person's, the person injury to stop the bleeding. Is there any question so far, guys? Is there any question here? All right, guys, we don't do ferita sanguinante. So all of us now, we now know what you need to do in case the person is bleeding. Let us now see what you need to do in case there is a foreign object in the person's eyes. Corpo estraneo in inocchio means a foreign body in the person's eyes. What do you need to do as you want to do first aid? Watch. Se la vittima, if the victim person presenta un corpo estraneo in inocchio, maybe something entered into the person's eye during the accident. For example, scheggia di vetro. What do you know scheggia? Pieces of glasses. Is it clear? Name is scheggia. Vetro mean glass. Legno, that's wood, or art or anything. What do you need to do as if you want to do first aid? Number one, bisogna bendiarlo. Cover it. Bendiarlo means cover it. It's the same thing as fasciatura. Cover it. It's the same thing as coprire. But in this situation, they say, may you cover them with something. Senza procedere ad altre manovre. Don't go and do any other action. Simple. If there's a foreign object in the person's eye, because think about it. So the person, if the person's eye is open like that, the person might be suffering. They say cover it. Just cover the person's eyes. Is it clear? Non bisogna rimuoverlo. Quindi, impedire che la vittima si tocchi l'occhio ferito. Now, avoid the victim person from touching his eyes. Is it clear? Don't allow the person to touch his or her eyes. And non massaggiare la palpebra. What is the palpebra? This place. Don't go and massage it. Because when the person's eye is paining him, don't go and massage it. Don't allow the person to touch his eyes. Is it clear? Palpebra means I don't know what they call it in English, this side. Per evitare lesioni più gravi, to avoid serious damages. Attendere l'intervenire di uno specialista. Now, who is this specialista? Ambulance to come. Is it clear now? Attendere means now, while you are waiting, now wait for a specified somebody to come. Is it clear? Non è vero che bisogna costringere a questa vittima qua di tenere gli occhi aperti. No, you don't need to tell the person to open his eyes. They said you should do what? Bisogna bendiarlo. Cover the person. So the person will not even see sunlight because the ray of light can even make the person eye to be paining him more. Bisogna bendiarlo. Is there any question so far, guys? So then it's better you ask question, no? Because all these topic are not good. Ask question, no? Is there any question? Ask question, no?
No question yet.
All right. Let's continue. Now, stato di shock. Now you arrive to a situation and the person is in a state of shock. The person is in a state of shock. The person in a state of shock. Now, we're going to see, how do you understand that the person is in a state of shock? Is it clear? Now watch. Lo stato di shock simply means molto simile a uno svenimento. They say it's similar to what? Fainting. Svenimento means fainting. Now in Italiano, any word that ends with mento, in English, now ing. Ing. Is it clear? Svenire means to faint. Why svenimento means fainting? Now they said state of shock is similar to fainting. How is it determined? What causes it? È determinato da una caduta di pressione del sangue. Now they say it is due to what? a low pressure of blood. Now, low pressure of blood. For example, now the blood is not flowing even to the brain. Che crea una riduzione dell'afflusso di sangue. It now causes what? Reduction of flow of blood. Is it clear? Con gravi danni per cervello e cuore. And it can cause serious damages to the brain, not the cervello, and to the heart. Is it clear? This is a state of shock. And this is what makes people to faint sometimes. Può essere causato da, what causes it? Forte dolore fisico. Serious physical pain. What causes it? What can cause it? Gravi traumi, serious trauma, serious trauma. What can cause it? Forti emozioni. Oh, you just win 1 million euro. You can gain it, you can go in a state of shock. You see I'm now. Forte perdita di sangue. When you are losing blood too much, all these things can cause state of shock. Può manifestarsi attraverso diversi sintomi. All these things can manifest through these symptoms. Now, how do you know that somebody is in a state of shock? These are the symptoms. Number one, presenza di brividi. What is brividi? The person will be shaking as if it's in a fever they do. That is state of shock. Are you guys writing it down? So it comes out in quiz because they can carry something they explain inside state of shock. Ask you a question concerning corpo, estraneo nell'occhio. That's why I always say write it down so you can do quiz immediately. Next one, pelle molto pallida. Now, we black people, you don't see it many times, but on white people, you will say that their face will not become so white or so red. Is it clear? Pelle molto pallida. Next one, sudorazione fredda alla fronte. On their front head here, they will not be sweating. Just here, they'll be sweating. All these things are the symptoms of state of shock. Frequenti battiti del cuore. It happens to many people. Your heart will be beating fast, 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 fast. Frequenti battiti. Battiti means heartbeat of the heart. Is it clear? Improvvisa pronuncia di frasi e parole senza senso. The person might be pronouncing or be saying words that doesn't make sense. Is it clear? Now watch. Infortunato also means vittima. Infortunato, now the person that was injured. It means the same thing. If you want to write it down. Infortunio means injury. Infortunato means the person that is injured. L'infortunato in stato di shock deve essere steso a terra. Now, the person that is injured, that's in a state of shock, needs to be placed on the ground. Steso a terra means the person should be placed on the ground. Another word for steso a terra means sdraiato. The person should be made lie on the ground. Watch. E va coperto per evitare depressione di calore. Now, he said, cover the person so the person will not lose heat. Now, do you know that if the person, he breathes into the person, but the person can cause fever, and this thing can now make the person to be shaken. Is it clear? All right. Now they can say, cover the person with a material. If you find it now, bisogna tenendoli, se possibile, le gambe sollevato di circa 20-30 centimetri. Watch from the ground. Raise the person's leg from the ground at least 20 or 30 centimeters. Now, how do you know 20? Now, 90 degrees. Now, whenever the person did L shape, maybe 90. If you can't carry that L with the vertical form, raise and they go down, raise and go down. On the middle now, 45. If you raise and go down, we now arrive to 20 or 30 centimeters. They can say rispetto al corpo. Is it clear now? The person's leg should be raised 20 centimeters from the ground. Now, it's not even an easy thing to do because for some of us, we want lose our belly fat. If you raise your leg 20 centimeters from the ground, your leg will pain you, your belly will pain you. Now, they say help the person to do it. Sollevare means help the person to raise the leg. This is how you save the person's life. 20 to 30 centimeters from the ground. While you are doing these things, they said, per favorire l'afflusso di sangue al cuore e al cervello. So you can now make the blood to be flowing to the chest, to the heart, and to the brain. Is it clear? So we don't learn one thing. To make the brain and the blood, for blood to flow through them, is to raise the leg 20 to 30 centimeters. This is a state of when the person is in a state of shock. Is it clear? All right, guys. Is there any question so far? Is there any question? Is there any question? All right. And we say don't declare. But unfortunately, or better still, Fortunately, if you want to do quiz, you do quiz on this thing. Stato di incoscienza, state of unconsciousness. Now, be inconscienza, unconsciousness. You don't even know what is happening. You're in a state. We have seen state of shock. We're now about to see when you did for unconscious state. Now watch. Se un ferito della strada è in stato di incoscienza. Watch. Number one, how do you know? Non reagisce a stimuli semplici. The person will not even react to simple simulations. If you touch the person hand, the person will go move. The person is unconscious. Number two, non è in grado di eseguire movement. The person cannot execute movement. He can't even move. Number three, non è in grado di rispondere a una domanda. So now, students, what are we trying to do now? Now, we have seen different situations. I would have loved to ask question here. Now, you arrive to a place. You see the person is not able to move. You see it now. The person is not able to move. Now, understand that the person might be unconscious. You arrive to a place, you see the person, they bleed. You now know what to do. You arrive to a situation, you see the person, something, the person cannot even open his eyes because the person has scagia di vetro in the eyes. You know what to do. You arrive to a situation, you see that the person is not able to even speak. The person might be in a state of what? Of unconsciousness. You arrive to a place, the person is having heat in the front head. What do that one mean? Let me call a student. Let me see. Miss, all right, Mr. Jeff, you arrive to a situation, you as the Sokoso now, you arrive there. The person is sweating in the front head. What's that a sign? Sign of what? Start of the shock. Thank you very much. I'm happy. All right. Thank you, my brother. They follow me well. Let's continue, guys. Non essendo capace di provvedere a se stesso. What does this mean? Now, because the person now, in this situation now, they're in a state of unconsciousness. The person is not capace di provvedere a se stesso. The person cannot take care of himself. Because the person is unconscious. Provvedere means he cannot even take care of himself. Bisogna vigilare sulle sue condizioni. You need to vigilate the person condition, control the person condition, e prendersene cura, and take care of the person fino all'arrivo del personale medico, until a medical doctor comes there or ambulance comes there. Now watch, they're giving more information. Muovelo solo se si è certi che non abbia trauma alla colonna vertebrale. Now this thing is very important. Let me break it down for all. They said, move the person only if you are sure the person is not suffering from trauma to what is colonna vertebrale, to the spinal cord. Now be colonna vertebrale. If you want to write it down. Now, how do you know? You know that if the person is not in a state of shock, the person will move. If the person, maybe if the bone is paining the person will shout, yeah, 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 this kind of thing. Now, the person is in a state of shock. They say you can only move the person only if you are sure. You see it now. Only if you are sure the person is not suffering from any trauma from the spinal cord. Is it clear now? Bisogna verificare se respira ancora. How do you know? The person is unconscious and you want to verify if the person is breathing. Remember, you have to be careful for your movement because we've learned that just do immediate and simple things. You want to check if the person is breathing. That's the first thing you need to do. How do you do it? Ponendo la mano sulla parte bassa laterale della torace or addome. Now, for those who don't know the meaning of torace, let me show you. Now, in this particular part, we are going to be showing some pictures. Now, where's your toraccia? Let me show you pictures now. It's what you are seeing here now. This upside, from your, it's close to the neck. It's close to the neck area. From that toraccia, you can check, that place, it a pump. If you are breathing, you will feel it. Is it clear? You don't need to turn the person because the person spinal bone might be paining him. But they say from the toraccia, you can see if the person is breathing. Put your hand there and see if the person is breathing. That's number one. Number two, check the abdomen. You can check the person's belly, the abdomen. Check if the person is breathing. This is what makes you understand if the person is still breathing or if the person is still alive. Next one. Se respira fatica, libera naso e bocca da eventuali ostruzioni. Now, if the person is still breathing, the person is still alive. They say, and the person is unconscious. Remember, you need to take care of the person. It says, liberate the person's nose and mouth from eventual obstruction. Now, if it's that time that we used to still wear mask, come out the mask immediately so the person will feel breathe. Is it clear now? That's a typical example. Se respira spontaneamente. Now, if the person is breathing small like this, polo means put the person in posizione laterale di sicurezza. The person should lie down laterally. Students, follow me for this part. Say, picture no dey here. If I be you, I will follow me. Or might see if I can. Let me see if I can show you picture. What I mean.
Even for Skuresa, they change, they will still teach you these things.
Eh?
For at the change, like all those
Anti-Jado. Okay, you don't see
say,
them.
they will still teach you for all those things. How
Yeah, that one.
maybe person.
Yeah, that one. On that one, they can teach you that one. Yeah, there are some people that do first aid as this thing, as hobby or whatever. They will teach you all these things. It's very important that see. These are simple things we need to know how to do. Okay, you can save somebody's life like this. Now I want to show you something. Look at number 4. Look at this number 4 now. Watch. They said if the person is breathing spontaneously, Paulo in position laterally sequencer. Put the person to lie down laterally. Is it clear now? The person should lie down by the side. Con molto cautela. Remember, you don't know if the person's spinal cord is paining him. Sdraiato su un fianco. You see now. The person should lie down on the side like this. Watch you. Contesta reclinata all'indietro. The person's head should be facing the back. Should just turn the person's head a little bit backward. Is it clear? Raise the person's head a little bit backward. The person's head should not be down so the person can breathe. All right. So the person can catch air. That's why they say you should raise it upward a little bit. Per favorire una buona respirazione. Is it clear now? Watch. Gamba piegata. Gamba piegata is like this. Number 4. The person's leg should be bent like this. Number 4. All right. Braccio piegato. Braccio piegato. Siamo. Braccio piegato. Watch. In modo da fornire sostegno alla testa. Because the person's head should not be on the ground so the person can breathe. Put the person's hand under the person's head so the person can be, the hand there is creating an appoggio. What is an appoggio? Like a help to the person's head. Is it clear? All right, so the person can breathe. Bocca aperto. Open the person's mouth. Rivolto verso terra. The person's mouth should open his mouth towards the ground. Per facilitare la fuoriuscita di liquidi, in case the person wants to vomit. Because sometimes when this comes situation, the person might vomit. They say open the person mouth so the person can't vomit, so the person will not choke. Is there any question here concerning stato di incoscienza? Is there any question here, student? All right. Let me say we don't understand everything. Now, guys, watch. Next one. Trauma alla gabbia toraccia. Now, what is this gabbia toraccia? Now, gabbia toraccia. Some people, gabbia no mean cage. Do you know your see, I teach you now physical education. No, what? So that's if they owe me here, you need to pay my money, honestly. I want to show you something. What is this gabbia toraccia? Do you know that this thing, the way God take create us, all these things you are seeing here, it protects all these toraccia, all these things. It is made in a way that it protects our vital organ there. That's why when you fall and you break these things, do you know how painful it is? If these things are not there, if we don't have this cage that look all this what they call it in English? Hello? What I don't know the name in English.
Ribs.
Ribs. Ribs. Thank you very much. The ribs. If we don't have these ribs, it is very, very dangerous. You have your pulmonary here. I don't know. You have your kidney, you have your lungs here. All these things, they protect them. Your ribs, they protect all these things. And the way God take create us in a very wonderful way. See, your kidney, it is being protected by this thing. If these things break, which is easily to break, but not meat, it is dangerous. You just die immediately for hemorrhage. Now, all these things, all these ribs here, they are made to protect us. So instead of the kidney from breaking, instead of the kidney to burst or the lungs, now this is what break, the ribs break. Now they call this situation, they call it what? Gabbia toraccia. Gabbia because na cage. It they protect. Are you guys following me now? The way the God they create us is wonderful. Let's continue. Now they can say watch. Può comportare fratture delle costole. What is costole? Costole na ribs in Italiano. Is it clear now? Now, if you have trauma to this gabbia toraccia, which is everything there, that cage, where they cover your body, the internal part of your organ of your body, they say it can compromise. What is mean of fratture? Breaking. Is it clear? Breakage of your ribs. Not only ribs, or dello steno. Now, what they call steno? Steno can, for me, it's also mean ribs. Is it clear? Lungs. Is it clear? Aggravate da possibili lesioni al polmoni. They say it can now cause serious damages, serious problems to your kidney. Because you see now, this particular cage, they cover those particular things, those kidney, everything. Polmoni means your kidney. L'infortunato, that is the person that is injured now, respira con molta difficoltà because the ribs, they pain them. And he cannot breathe very, very well. Is it clear? Pertanto, what do you need to do as a first aid person? Occorre, you need to do the following. Number one, cercare di facilitare la respirazione mettendo questa persona semiseduto. What is meaning of semiseduto? I want to show you how you can stay in a semiseduto position. Semi-seduto. They say the first thing you need to do as first aid, write it down. Oh, put the person in a semi-seduto position. Something like this. Say, let's say, for example, say you're not in a hospital. The person just had an accident in that situation, in that place. Now, imagine that the car is here. You can put the person back to rest on the tires or rest on the car. The person will be sitting down. That's a situation of semi-seduto. Is it clear now, student? All right. This is how you help the situation in case the person have trauma in that gabbia toraccia. Are you following me now? Number one, what do you need to do in case they ask you, or in case I ask you, or you are doing quiz? Posizione semi-seduto. Simple. Number two, proibire di bere. Don't prohibit the person from drinking. It is dangerous. The rib just broke, and you call it drink water. I don't know where the water goes. E mangiare. Avoid the person, prohibit the person from eating or drinking. E assistere that person fino all'arrivo del soccorso medico. Is it clear? You can assist the person by talking to the person, keep the person alive until medical soccorso comes there. Se vi è la presenza di ferita visibile e profonda. Now, as you are there now, you can see the injury. Ferita visibile means you can see the injury is visible and it is deep. What do you need to do? Bisogna comprimere subito. What do you not comprimere? How do you do it? Use a very clean material, cover it immediately. That material should be sterilized, should be neat, not dirty material, where you just come up from somewhere. It should be neat. Comprimere means, put pressure on it. Subito, con panno pulito, senza provvedere a pulire. Don't go and clean it, guys. You're not a medical doctor. Don't clean it. Just cover it because that injury is deep. Cover it. Disinfettare. Don't use disinfettare. Don't even medicare. Don't go and medicate it because, guys, they say you should do simple things. The only thing they should do, you should do what? Cover it. That's all. Is there any question concerning trauma alla gabbia toraccia? So in case tomorrow you hear the word gabbia toraccia, you know what it is. I've showed you guys already. So you're not going to say you don't know what it be. Is there any question? So students, the way they teach you this thing, I expect you to do quiz on these things immediately. Frattura agli arti. What do you know of frattura agli arti? I will show you a picture. Now, frattura agli arti means we are talking about your joint. Your joint. You can't go break your joint. You can break your elbow, your joint, anything where your joint they move, your joint they there. It is very dangerous. Now watch. Frattura agli arti. Think about it. Think about all the joints where you know. Let's show this picture. Your joint, for example. Now watch. La frattura è la rottura di un osso. You might understand that when your joints break, have you seen those people that play football? Maybe their leg can't bend, can't break. It is the bone that is breaking. Is it clear? La rottura di un osso also mean the bone. Now watch. We have two types. Se esso fuoriesce della pelle e la frattura è detta esposta. Now watch. If that bone, because there are some injuries that the bone will shoot out of the skin, you will see it. That injury is called esposta. It can come out in quiz. Is it clear? Write it down. Esposta means it is visible. It is coming out. It is exposed. Are you following me now? Now, we now have the one that is not exposed, but the bone is broken. Some bone, they shift. It didn't necessarily shoot out of the skin, but it's broken. It is that one at dislocation. Dislocation. That one don't mean break. Let's continue. I segni principali di una frattura sono il dolore violentissimo. The pain is too much. It's so violent, the pain. Anche al minimo movement, even when you take a minimum movement. Dell'atto. Atto means joint. Joint. Arti means joints with S. One, only joint na atto. The person might have gonfiore. What is not gonfiore? Gonfiore means swelling up. That be gonfiore. Gonfi. You will say, a gonfio means it don't swell up. Or deformazione della parte lesa. That place can be deformed. Yes, that place will be deformed a little bit. Is it clear now? There's been of frattura. Watch. Si deve immobilizzare la frattura. You need to now immobilize the person. That injured person. Immobilize them simply means, watch. Do a simple thing by maybe, watch. Si deve immobilizzare la frattura nella posizione in cui si trova per evitare lesioni di nervi. Now, I'm not a medical doctor, but don't go and do waiting. Don't do things that nobody sent you because the person joint is broken. Now, for you to immobilize the person, they're even careful by telling they said, si deve immobilizzare la frattura nella posizione in cui si trova per evitare lesioni di nervi. They say leave the person and the person be. No go say may go put them back. Immobilize the person means just allow the person to be free. Is it clear? In the position in which the person is being found, like that, and to avoid doing what? Injuring the person's nerves, evasi, e minimizzare violenti dolori. Allow the person to be like that until the person comes, because the person can be in a state of shock. Is it clear? Because the pain is too much. And from that, the person can even become unconscious. Subito dopo è necessario attuare le normali misure anti-shock. We've learned state of shock. We've learned what you need to do. I know I ask question there, but we don't do them already. Now they call it anti-shock. They say maybe you do those normal things in that situation of shock. Practice those things. Now the next one, say in caso di frattura esposta. Esposta means the injury, the bone is shooting out of the skin. Cioè, dove l'osso fuoriesce della pelle. The bone is coming out of the skin, non di pelle. Non si deve spingere l'osso. Don't push the bone back. Don't go and do Superman. Nel tentativo di farlo rientrare. Don't do it. Ma prima di immobilizzare l'atto, before you immobilize the person, before you make the person to be free, just keep the person to sit down, stay one place that is, the person just be staying there without movement. Occorre coprire la ferita. Cover the injury and the bone con materiale sterile, which is sterilized material, or con un panno pulito. Now, in this situation, panno simply means material. Is it clear? Per evitare infezioni. Occorre sempre attendere i soccorsi. Now, wait for medical doctor or ambulance to come. Non è vero che è necessario chiedere alla vittima di muovere gli arti. Don't ask the victim person, the injured person, to move that joint, di muovere gli arti. No. The person might injure it more. The person will come break am more. Is it clear? They say immobilize the person. The person should just stay still. The person should be just stay still. Non è vero che you have to make the person to walk, to camminare, to reduce the injury. Don't do that. So students, we don't see different situations for every situation. Is there any question? All right.
30 minutes. You want your t-shirt? It's topic.
My
You
brother,
want kill us?
I'll tell you everything. If guys
The
don't
thing is,
don't
the
understand that now.
information is not too much, oh. So tell people right now, they
I
don't
just
flow.
okay.
They
You
don't see
want
anything.
kill us? It's topic. I hear the carton.
And with better information, so
I
way
tell you,
before
don't be
anyhow.
small thing, my brother. Don't be small thing. See, I will send all the videos on the pack. Everything we don't do so far, I go send them. Then we'll have a lot of things to study. So of course, no, I'm not sure we're doing exam today and tomorrow. So I can't get plenty things to study. Everything jam packed together. Next one now, Ustioni. What is Ustioni? Now, Ustioni, think about it. Ustioni means now, after an accident, fire can't catch the person. The person's skin is burnt. Ustioni. Now, what do you need? This one is very, very important. What do you need to do as first aid? What do you want to do? Very, very important. It can happen on the road. Ustioni means fire, heat, fire caught the person. The person's skin is burnt. The person's skin is burnt. Now, all these things now, why white people? But it is what. Now, they can say, watch. Ustioni. Se un ferito presenta ustioni. If an injured person is burnt, have the skin burnt. Number one, se ancora presenti fiamme. Now, it can happen. The person's skin, fiamme means smoke. Ah, God. It's very shocking. Smoke, see they come out for the person's body. If possible, bisogna spegnere. Off the smoke immediately. How do you do it? Suffocate the heat. Because how do you suffocate? You know, say if you remove oxygen from the heat, the fire will stop. Ad esempio, con una copetta. If you cover it, the thing don't get anywhere breeze the enter to make it come out more. Because if you remove oxygen from the fire go off. Then suffocate the smoke from coming out. This is a person's skin. Number two, evitare di togliere gli indumenti rimasti attaccati alla pelle bruciata. Now, the person wear jacka. Fire come catch the person. Now, both the jacka and the person body come mix together. Now they're telling you now that because when you come there now, you now see that the person the skin now you don't know which one be jacka, you don't know which one be skin. You see it now. So be very they said watch. Avoid removing the indumenti where you see there because that way they remove will be skin. So avoid, I'm sorry for laughing, but it's very serious. It's very, very serious, guys. They said avoid removing those indumenti that is attached to the body, to the pelle bruciata. Because what you are removing might be skin. Might be thinking, you might not say, no go peel am. If they come up person body, very serious. Evitare di togliere indumenti rimasti attaccati alla pelle bruciata. Bruciata means the person burnt. Bruciata also means burnt. Ustioni also means burnt. Raffreddare la porzione di pelle ustionata. Now, you can use a cold water, pour on that thing, because the person body, fire just burn am. If you pour cold water, they make it chill. Raffreddare la porzione di pelle ustionata con acqua fredda. Is it clear? You can chill the person's skin by pouring cold water on it. These are simple things you need to do. They say now, when person body is burnt, conviene coprirlo con materiale pulito. They say it's advisable that you cover it with a clean material, possibilmente sterile, sterilized material. Non disinfettare, guys, don't go and disinfect it. Don't go and apply pomade. Don't go and apply any kind of pomade or alcohol sulla parte ustionate. Student, is there any question concerning this particular topic called ustioni? Like play. We don't use 30 minutes finish a whole topic. Child, we did a wonderful job today. We are running. We are doing well. By Thursday, we'll finish everything. Okay, now, is there any question here, guys?
Teacher.
Yes, ma'am.
This one don't do now. You don't too much now.
I just say one last question. One to the last one. I'm coming back. I come one to the last one.
I mind this thing you did this story too much.
Too much. Now lesson what they do now. Now normal class they do. You know, say if you finish, you know you do quiz. So why don't we just use the opportunity learn more? Occhiali da vista or lenti. You know, so we don't talk about this before. If you remember when we talk about patente, codice armonizzato. There's some people who say for their patente they'll put a codice there because for them, when they went to register for patente, they have a really bad eyesight. Na normal thing. They have a really bad eyesight. And they now wrote it inside a patente. There's some people, for those of us in this class that wear contact lens, your own might be that very, very serious, severe, that you cannot do without. There's some people that even playing football, even doing sports, they need to wear glass, they need to wear their spec, they need to wear their contact lens. You see how serious it is? All right, they can say occhiali da vista o lente a contatto. Watch. Durante la guida si devono usare gli occhiali da vista o lenti a contatto se nella patente è presente. If they write in your patente that, see, because of your bad eyesight, you're supposed to be wearing contact lens all the time. It is important that every time you need to wear it all the time. And how did they write it? In your patente, what they said, esteso sotto forma di codice armonizzato 01. It will be written there, 01. It means, now, it is not for me and you to know what it means, but for in patente, it means that you are in your patente, you as a driver, you need contact lens. You need to be, every time you're driving, you should have it by yourself. Because it is, you have this medical deficiency that your eye, you know if you do without your contact lens. And it is obligated that you should have it. That is why in your patente, the right is 01. Is there any question so far, guys? Occhiali da vista o lenti a contatto. Like play. We don't finish everything concerning guida in relazione alla qualità e condizioni di guida. Responsabilità civile, penale, all this, we don't finish them. We are doing very, very well. Now, these three parts will remain here. We'll play with it and we'll finish it. But we'll stop here for today. Next one we wan come do na everything wey concern in case rain fall for ground, in case snow fall for ground, in case maybe your car is blocked on the road. We will see those ones in our next class on Thursday. We are going to meet Thursday, Friday, and we'll finish. Next one again we're going to see is
The one you said
limitation.
we're going to share our screen.
Yes, on Thursday we'll share our screen. We'll come do that here. We'll do them. Thank you very much, sir. Now we will now see also limitation. Now waiting. How do you have now? This one too a nice topic, but you know they come out well like that. But it's very nice. It's good for us to know how you go take reduce consumption of fuel. Waiting they make your car they consume fuel. As one they finish now, we will now discuss. There's a class we will now do. We will now discuss if you want to buy a new car. Waiting be those things we need to take into consideration. Is it clear? Which I need to take into consideration as I want to buy a new car? Because not be say I just want to go buy a new car. As a new patentator, don't go and do mistake. If you are going to buy these are here we'll discuss all these things. Because if you have to understand that we have what they call motor diesel. We have cars that go with diesel. We have cars that go with benzina. We have cars that go with methanol. We have cars that go with GPL. We have cars that go with electric. So if you want to, and you have your wonderful money and you want to go buy your car, you have to understand how to go about these things. You need to understand where you need to go, which one you need to buy. For example, now, we don't finish. We just, because these are things you need to know when you want to go and buy a car. We'll see all these things. If you are walking in a place that is very, very far, is it clear? Which you need to enter autostrada, it's advisable that you go with diesel, for example. And diesel is very, very costly. Diesel is very, please, diesel is very, very costly to maintain. It's so costly, and now I say people don't they want to even abolish, they want to even stop it because number one, it inquinates a lot, it pollute a lot, it's very, very dirty. Is it clear? That's why in many cities they don't allow diesel enter. In many centro they don't allow diesel enter because it pollute the air. Because now everybody now they do this green environmental all this they're trying to stop all this pollution and all these things. If you have benzina is very, very cheap. If you have benzina is good for people that are working close areas. Now, if you dey work for very close here and you can't go to drive diesel, after some time your car will get fault. Your car might have fault because diesel is supposed to enter express, it's supposed to run, enter autostrada, enter super run very, very well so that you free the bad this thing inside it. Is it clear? But now, benzina is very good for those people where they walk very, very close to their houses. Declare from one city to another, very, very close. Benzina is easy to maintain. Now, methanol is the cheapest of them all. Methanol, they very, very cheap. Now, but understand that before you go find car where they go methanol, they hard. But it did. Is it clear? We now have GPL, which is the that one is very, very cheap to maintain. And also, students understand that there are some vehicles that go with two alimentation. There are some vehicles that go with both GPL and benzina. So when you want to buy cars, these are the factors you need to put into consideration because fuel na money. Is it clear? Do you know that the more you dey on your radio, you dey on your AC, you are consuming fuel, you dey consume more fuel. They say now. So you have to be careful what you need to buy. Now the whole world now they go with electric. So all these are the things you need to put into consideration why you don't for those who want to go do exam and you think of buying a new car. So you need to put all this into consideration. Which type of alimentation I want to buy. All right, students. Remember, from next week we're starting a new class immediately. Pay before you start, €80 to start. Will they start immediately? I go advise for those who are serious. Now, not say for this, you can. It doesn't matter whether you know understand anything in this session. It doesn't matter. There are some students will be say they need to do this in like 3-4 times before they will come pick. If they happen, you need to know the kind of student you are. Forget about say at the tell and say study. You as a student, you know when you need them. Trust me, you know when you need them. So trust me, you can start immediately. Now €80 now. Join immediately. We won't start. Tell your friends. Tell your brother. I'll do you sconto. All right, guys. Thank you very much. We'll see you.
You say €80. You say you'll do sconto. Oh, that
I'll
means
do
if you bring
so.
person, if
You
you
never
bring
bring me person
person, that
before.
€80 we not go pay off. Now you mean?
No, yeah. If you bring person, you don't go pay €80.
Eh?
Yeah. Yes, man. You never bring